In general, walking is the number one activity for all of our health and our joint health as well. We know that actually one of the reasons the epidemic of arthritis is going up is frankly because we are not walking enough. Cartilage, which is the end of the bone, um, needs to be nourished, and it needs to be nourished by walking. And so, rest, which is what we used to think would be good for an arthritic joint, actually isn't good at all. And so movement and walking is the cartilage on the surface. And when people first start getting bone on bone, they usually have it doesn't occur at all parts of the knee at once. And so there's usually a period of time where people can actually walk quite well if they continue to move. But the cartilage is a little bit like a rubber tire. If you take a rubber tire and you set it in your garage for 5 years, it's going to be brittle and cracked, even though it was never used. On the other hand, if you have a tire that's somewhat threadbare, as long as you keep moving it eventually will fail, of course, but you'll get more life out of that tire than you would out of a brand new tire sitting in the garage. So our bodies are designed to be moved. Even with bone on bone, people can move usually more than they think they can. Um, and that's where things like walking sticks and not canes because they don't walk naturally, but walking sticks like the backpacker used to offload some of the weight can be extremely useful. So I really encourage all my patients to walk 30 minutes every day, pretty much regardless of the x-ray status of their joint. The problem is once it becomes the point where it's just causes too much inflammation, that's when you got to consider surgery. But it's shocking to people sometimes when they actually do try to engage before surgery with some physical therapy and some walking, that how much better they feel, even though it doesn't obviously change the bone on bone condition.